Hey, Miss Kiera, my name is Delilah Stinson, and I'm a nursing student at the University of South Alabama in Mobile.
Okay.
And today you're going to be my patient. Do I have consent to record you?
Yes, you do.
Miss Celeste, can you scan the room?
Yes.
So today, at the beginning of my assessment, actually started when I walked in the room, your hygiene, you look clean, you look dressed for the inside, you look appropriate, your groom, really, really nice. So I would also like to ask you, how are you feeling today?
I feel great.
Good. No sadness, no anxiety, no depression?
No, none.
Okay. So if you were depressed or feeling anxious or anything like that, we would do further screenings.
Okay.
And then possibly get you some resources to further assist you. Can you tell me what today is?
Today is Sunday.
Okay. What time?
Approximately 7:30.
Okay. Do you know where you are?
Yes, Montgomery.
Okay, good. So that means you're alert and oriented times 3. You can tell me where you are, the city, the day, and the time. Can you recall what you had for dinner?
Yes, I had fish.
Okay, good. What about who is our president?
Trump.
Okay, so you were able to tell me a most recent event, what you ate for dinner, and you're able to tell me what who our president is. Okay, so what does it mean if I say it's like finding a needle in a haystack? What do you think I mean when I say that?
It's gonna be hard to find.
Good, that's correct. And what about any goals, anything you're looking forward to as far as your long-term goals or recent goals?
I would like to become a nurse as well.
Oh, good. Good. So, since we talked about all that, I'm just gonna move straight into the cranial nerves. The first cranial nerve that we will assess is the olfactory nerve, is number 1. Can you take your hand and sniff, holding one nostril? Opposite. Okay, so basically we're checking the patency of your nostrils, and I would have given you 2 things to smell. If you were able to smell those 2 items, identify them by name, then that means that your olfactory cranial nerve number 1 is intact. Okay? So next we'll move to the optic nerve that assesses your vision. Okay? So the first chart, it would have been like a Snelling chart where you would stand 20 feet away and it would be up against the wall and you'll read the lowest line.
Okay.
Okay, and then we will give you your results and tell you how far away you can see what a person with no vision problems can see at those feet. Okay? So can you cover one eye and read the bottom line?
LTFPH.
Good, you have 20/20 vision.
Okay.
Okay, so there are no deficits. Optic nerve, cranial nerve number 2 is intact. So at this time, I'm going to take the size of your pupil. Your pupil size looks like it's about 6. Okay? And they're both even, your eyes are even bilaterally. And so now I'm gonna check your consensual light reflex, and I'm gonna shine the light in one eye and watch it constrict in the other.
Okay.
Okay? So this is your right, and it did constrict in your left. Let's show up. Your right, moved up. Okay? Now this is your left eye, and it did constrict on your right.
Okay.
So now, what I'm gonna ask you to do, I'm gonna ask you to look at the wall. And this is assesses your accommodation. Farther away,
Okay.
your eyes should dilate. When I bring something back closer to you for you to look at, it should constrict.
Okay.
So can you look at the top of the clock?
Okay.
Okay? Let it dilate, and now look at this pen. Okay, so it constrict. So next, I will check your convergence, okay? So follow these. Don't move your head. Okay. So basically, convergence, your eyes, there are no deficits. They are moving smoothly on the axis. So now I'm about to assess your extraocular movements. Can you follow my hand? here, here, and here, 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 and here.
Okay.
So all of those are intact. So next, I'm going to assess your, I just assessed your, cranial nerve number 3, no, cranial nerve number 2. And your extraocular movements, which was 3, your own 3, 4, and 6, which is the oculomotor, trochlear, and your abducens. Okay. So now I'll do number 5. Okay. Number 5 is the trigeminal nerve. Okay. So basically, my hands are clean. Do you mind if I touch your face? Can you just palpating your what's in your face? Okay. And so I want to assess your sensory.
Okay.
Okay. So tell me if you when you feel this.
I just felt it.
Okay.
I feel it. I feel it.
Okay. Now, I would also give you something to taste.
Okay.
Okay. And if you're able to identify sweet, salty, bitter on your tongue, then that means that your trigeminal nerve is intact.
Okay.
Sensory and motor.
Okay.
Okay? So, I've already assessed the abducens, which was cranial nerve number 6.
Okay.
And so now I'm doing cranial nerve number 7, which is the facial nerve. And your facial nerve, can you smile for me? Okay, stick your tongue out. Okay, close your eyes. I'm gonna try to pull them open. I'm trying to pull on your chin, open your mouth. Okay, good. Cranial nerve number 6, the facial nerve is intact, sensory and motor. So now I'll be moving to the cranial nerve number 8, which is the acoustic, and I'll be assessing your hearing for high frequency sound.
Okay.
Okay? So I'm gonna cover my mouth and tell me what you can hear. Repeat after me.
Okay. Bird.
Okay? Sweet.
Sweet.
Okay, so your cranial nerve number 8, your acoustic nerve, is indeed intact.
Okay.
So once we move from cranial nerve number 8, I'm moving to cranial nerve number 9 and 10. Okay, which is the hypoglossal and your vagus nerve.
Okay.
Okay, so I'm going to check to see if your uvula is in the middle or midline of your mouth.
Okay.
Say ah. Okay. And it is intact. Everything is in midline. And next I'll be assessing cranial nerve number 11, which is the spinal accessory nerve. Can you hunch your shoulders up? Okay. Turn your head to the left. To the right. Okay. So, and cranial nerve number 11 is intact.
Okay.
Also, for the hypoglossal, we will also test your taste. That goes with cranial nerve number 9 and number 10 to put different little things on your, different flavors on your tongue for you to be able to identify.
Okay.
So moving on to cranial nerve number 12, which is the hypoglossal.
Okay.
Okay. Cranial nerve. So I'll need you now to repeat after me.
Okay.
Say light, tight, and dynamite.
Light, tight, and dynamite.
Yes. So cranial nerve number 12 is intact. So at this time, I'm going to ask you please stand. I want to just check your gait. And you walk. Can you walk just over here about 20 feet, heel toe, heel toe, heel toe, heel toe, heel toe. Okay, come on, baby. Okay. Good. Now I want you to stand. I'm gonna have you to turn around.
Okay.
I want you to close your eyes. Side by side. This is the Romberg test. There is no swing. Her Romberg test is negative. So now, what we're going to do, before I test your reflexes, I want you to identify a sharp,
Okay.
and this is gonna be dull,
Okay.
okay? So I want you to be able to tell me identify if it's sharp or dull.
Okay. Sharp.
Okay.
Dull. Dull.
Okay.
Sharp.
Good job. So now, I am going to test your reflexes,
Okay.
okay? I am going to, typically I would do them bilaterally. Well, I guess I need to do them bilaterally.
Okay.
Okay, so this is going to be your bicep, and kind of relax a little
Okay.
bit. Kind of relax just a little bit
Mm-hmm.
for me. Oh, I have a little reflex. I would say that is a +2. Good, I was shocked. Can I actually stand?
Okay.
I'm going to do, let me do this side.
Okay.
I guess I was excited that ooh, good. That will be a +2 standpoint. So now we're going to just relax.
Okay.
We're gonna do, that was the bicep. So now we're gonna do the tricep. Good. Just relax. Good. +2 on both sides. Now I need to do your brachial radius. Let's hold it together. Let's see. Okay. +2 on both the right and the left. So now we're gonna move down to the patella.
Okay.
And we're gonna do that. Okay. Oh, good. Those two.
Okay.
And then, so I've done the patella, and so now I have to do the Achilles. And typically with the Achilles, it's supposed to be like dorsiflexion. Okay, good. Oh, good. So all of her reflexes are +2 for the bicep, the tricep, the patella, the Achilles, and also the brachial radius. And now we just have to do the Babinski. And so basically we do that. Okay, good. So her Babinski sign, it was negative. So during the entire assessment, I've also been assessing your level of consciousness.
Okay.
So so if it was like a 7 or below, then that means you would have been in a coma. 15 was the highest score that you can get with the Glasgow Coma Scale. So basically, your verbal response was a 5, your motor response was a 6, and your eye response was a 4. So you have a total score of 15.
Great.
Okay? So thank you for allowing me to do your assessment.
Yeah.